Let's start with the topic bronchiectasis. First of all, we will see the definition. It is defined as the irreversible dilatation of the bronchi and obliterative fibrosis of the bronchioles. The dilatation is due to the destruction of the cartilage and smooth muscles. Now the types it's having the tubular cylindrical type, then the varicose type, then cystic type. Alright, now the etiology. It's most common in females than males in the age group of 6th to 7th decade. Then first etiology is post-infectious. Okay, mycobacterium and tuberculosis in case of adults, and measles and pertussis in case of children population. Right, bronchiectasis can be congenital and acquired, or it can be focal or diffuse. Infection is usually due to diffuse bronchiectasis. Right, then obstruction due to the lymph node in case of tuberculosis. Then third is the impaired mucociliary secretions. Okay, fourth is what we called as obstruction, impaired mucociliary immunological IgG related disease. Then fifth is autoimmune Sjogren syndrome is one of the cause of bronchiectasis, right? Then the pathophysiology. First is impaired mucociliary function, right? When the mucus does not, then it will lead to piling of mucus. Second is goblets are hyperplasia due to the glands hyperplasia. Third is obstruction and inflammatory reactions in the airways. Right, then there is Coley's vicious hypothesis. Pseudomonas aeruginosa, Staphylococcus aureus, then Bacillus capeci and Haemophilus influenza. They lead to infections. Infection will lead to inflammatory reaction. It will lead to exudation in the airways and destruction of cilia. Cilia destruction will lead to secretion of mucus, piling of mucus, then secondary infection. This is a vicious cycle. Okay, then the signs and symptoms. First of all, symptoms: persistent cough with expectoration, foul smelling and blood tincture, hemoptysis, dyspnea, wheeze. These are the symptoms. Okay, then signs of bronchiectasis are, first of all, rhonchi and bronchial breathing over the patch of bronchiectasis. Okay, then crackles will be there. Okay, crackles will be there, clubbing will be there, cor pulmonale and features of right ventricular failure will be there. And then X-ray findings will be, there will be bunch of grape appearance, finger and glow appearance, tram track appearance. Okay, Then CT findings is signature appearance, the characteristic of this. Okay, then investigations are over. Then the treatment, physiotherapy and clearance of secretion is the cornerstone of treatment. Okay, then we use nebulized 7% hypertonic saline for nebulization. We can use recombinant human DNAs for cystic fibrosis. We can use assisted device, cuff assist device called flatter valve device for the clearance of secretions. Nebulizer gentamicin for infections, and the macrolides and beta lactams are the antibiotics which reach the lung at a sufficient concentration to clear the infection. Okay, then it's over.